Good evening and thank you for joining us. I'm Catalina Gillies. OPP are confirming that one person died in a collision which shut down Highway 17 for over 10 hours yesterday. The crash occurred around 1 p.m. just west of Chappaqua. A 38-year-old woman from Thunder Bay died when her passenger vehicle collided head-on with an oncoming transport truck. The 64-year-old man driving the rig was not hurt. The highway between Uppsala and Chappaqua reopened just after midnight. Meanwhile, OPP were on the scene of another collision today, about 20 kilometers west of Nippigan on Highway 1117. Police say 5 vehicles were involved in the crash, which occurred at around 11:15 this morning on the 2-lane section of the highway. Fortunately, the injuries were all minor, as several occupants were sent to hospital. The OPP says the highway was cleared and reopened within a few hours. A Thunder Bay man charged with killing another man and seriously injuring a third person in 2019 has been handed a 6-year prison sentence. 24-year-old Nathaniel Austin Wesley was charged with second-degree murder and aggravated assault after the violent incident on March 20, 2019. City police responded to Cumberland Street following reports of a male on the ground. Police were told a baseball bat may have been used during the assault. Police located 2 male victims. One of them, 58-year-old Claude Justin Kishaqueb, was pronounced dead soon afterwards. In March of this year, Wesley pleaded guilty to the lesser charge of manslaughter as well as failing to comply with a probation order. All other charges were marked withdrawn at the request of the Crown. The judge consented to the joint submission for a 6-year sentence. However, Wesley was credited with pre-sentence custody, leaving him with 2 years left to serve. Upon his release, he will be subject to 3 years probation. The Northwest continues to see a steady stream of new cases of COVID-19. The Thunder Bay District and the Northwestern Health Units released their latest data this morning. The TBDHU is reporting 9 new cases today. 8 of them are in the Thunder Bay area, while the other one is from the district. The active case count is now sitting at 64. That's down 1 from yesterday. And there's now 1 less district COVID patient in the regional hospital, bringing the total number to 2 with none in the ICU. Meanwhile, the surge in cases continues for the Northwestern Health Unit. There are 23 new cases being reported today, and the number of active cases there has risen from 102 to 115. 7 of the new cases are in the Kenora area, 8 in Red Lake, and 5 are in Dryden. There's 1 each in Sioux Lookout, Emo, and Fort Francis. More government support is needed in Kenora. At least that's what local officials are saying after they declared a second state of emergency over COVID-19 yesterday.
This is the worst we've had it in Kenora since COVID started.
With 53 active cases in the Kenora area, local leadership has grown very concerned. Emergency isolation centers have been set up and are quickly being overwhelmed, as are hospital staff, police officers, and a number of involved agencies. Kenora Fire Chief Kent Redmond says they've been in contact with the federal and provincial governments since Friday, pleading their case for assistance.
Clinical staff, we need mental health support, things like that to help out, 1, with the isolation centers, and 2, to kind of either relieve some other medical areas that are, redesignated staff to the isolation centers, or to backfill their positions.
The Northwestern Health Unit confirmed today that tests for the Omicron variant have come back positive for the first time in that region in both Kenora and Dryden. While the lines are long for rapid test kits across Ontario, public health officials are reconsidering how PCR and rapid testing is done. Mike Walker has more.
With rapid tests in short supply and high demand, hundreds of people camping out in a cold parking garage at Yorkdale Mall this morning, hoping to pick up a free kit and peace of mind ahead of Christmas.
6 a.m., I believe, is when we got here. We're waiting for the rapid test for Christmas so that we can actually see our families.
My family all wants to take a rapid test before we actually do gather.
At Union Station, people started lining up at 4 a.m. This man drove from Lindsay.
I traveled 2 hours to get here because my riding doesn't have any pop-ups at all.
Thank you.
Only 1,000 kits available at both pop-ups today.
We don't have enough for every year.
Handed out in a matter of minutes.
I feel happy about going to see my in-laws and my mom.
They could have done it a little bit more smoothly, maybe had more locations doing it.
The large lineups at Union Station in the past week leading to overcrowding concerns, forcing Metrolinx in the province to cancel pop-ups scheduled for tomorrow and Friday.
The demand is so intensely high, we can't safely manage people this many and safely during a pandemic.
It's also prompting calls for equitable access. Mississauga's mayor urging the province to ramp up distribution at community hubs.
We must bring the test kits to the people and make it as easy as possible to access the tests.
The province is distributing 2 million free rapid testing kits between now and mid-January to help reduce the risk of transmission in the face of the Omicron variant. But health experts are stressing caution.
Everybody needs to understand they're not perfect. If you have symptoms, regardless of what your test result shows, a negative test does not in any way guarantee that you do not have COVID.
At this point, the Ministry of Health says its supply is limited, and every single kit it has received from Ottawa has been sent out across the province.
I believe that this should be organized in a better fashion. Possibly the postman can deliver one to each household at least.
Leading to frustration for many who once again find themselves leaving empty-handed.
As the Omicron variant continues to show up in provincial COVID cases, the odds of kids going back to school in early January remains a big question mark. Thunder Bay's two largest school boards are preparing for the worst, but have hopes for the best. Mitchell Ringos reports.
Thunder Bay Catholic Board Director Pino Tassoni says he's an optimist and is hopeful they will be back to face-to-face learning on January 3rd, as he believes the Ford government doesn't have an appetite to go back to virtual learning. The board did prepare for that possibility on the last week of school, but Tassoni wants everyone to enjoy their Christmas and not worry about the decision until it's time to head back, and insist their schools are the safest places for students and staff to be.
We are very firm with our health and safety measures in terms of PPE and screening and everything that we need to do within our schools to keep our kids safe. So I'm hopeful that we will be back, but health and safety, that Omicron will trump everything that we do. So it could happen, but if I were a betting man, I'm hopeful that we will be back face to face.
Lakehead Public Schools Director Ian McCrae is also very optimistic they will be able to go back to school in early January, as he says there is no substitute for kids being in a classroom with their peers, their teachers, and school support staff. McCrae says having to go back to virtual would be particularly devastating at this point. The board is hoping to hear a decision within a week before the restart of classes so they can properly prepare to gear up for another learning situation. But he's hoping that is a last choice scenario.
We're hoping that with the vaccine situation improving and people being more cognizant of their responsibilities with regard to masking and distancing and not having large gatherings over the holidays, that we'll be able to return to the situation that we left prior to the break.
And only time will tell if the kids will come back to school on January 3rd or if they will have to go back to virtual learning once again, as that decision will be up to the Ford government with input from local health units. Mitchell Ringos, TBT News.
Today marks the one-year anniversary of the first COVID vaccination in Thunder Bay. Since then, more than 270,000 doses of Pfizer, Moderna, and AstraZeneca have been given out in the Thunder Bay district. The rollout has been a monumental effort by local health officials. And it's not over yet, as booster shots are being offered help to prevent another wave of the pandemic. Daniel Bain has more on the past year of vaccinations.
To be the first person to get it was a great honor and pride.
1 year ago, Sean Bolton, a personal support worker with St. Joseph's Care Group, was the first person in the Northwest to receive the COVID-19 vaccine. The rollout started slowly, but before long, thousands of people were attending local vaccine clinics each week. Thunder Bay Regional President Rhonda Crocker-Ellicott remembers vividly what it was like to be able to start providing vaccines to the city of Thunder Bay.
I reflect back to this time last year and how anxious and enthusiastic we were to be receiving the first vaccines in Thunder Bay as one of those first hospitals to have the privilege of being able to roll that out to really give that layer of protection to initially to staff and then to vulnerable and at-risk patients. So It was really a privilege to be a part of that initial rollout and all of the enthusiasm and planning and that came around that.
The vaccine was eventually expanded to be available at pharmacies, and then last month, children aged 5 to 11 became eligible. So far, 30% of that age group has been given their first dose. After a year of clinics and appointments and encouraging the public to get the jab, District Medical Officer of Health Dr. Janet DeMille is happy at where the district is in terms of vaccine numbers.
It was 89.9, so I'll just say 90% coverage rates for individuals 12 years and older up for first doses. So I think that that's really awesome. And to think that nobody was vaccinated a year ago, we've come a long way.
DeMille added that despite the arrivals of COVID variants, there is evidence that the vaccines are working, and it can be seen in the spread of the virus in elementary schools versus high schools, as well as hospitalization numbers.
Right now, I also believe that there's only 2 individuals in hospital, whereas given our case numbers, I would have expected more if we weren't a vaccinated population. So I think, this is a real tool, a real benefit that we have as a community and as communities.
We're seeing booster vaccinations, the third dose of vaccinations, and early word with respect to the potential effectiveness of that against Omicron variant.
Both DeMille and Crocker-Ellicott are happy with the vaccination numbers over the past year, but want to stress the importance of getting a booster shot once eligible to help keep the city safe and to keep hospitals from overcrowding. Danielle Bain, TVT News.
A favorite attraction of the West Fort neighborhood is back again this Christmas season. Residents in the area have been catching a glimpse of Santa Claus on a brightly lit modified bicycle riding up and down the streets. He's better known as the West Fort Santa, and today he was waving at vehicles and passersby along Arthur Street and spreading joy this holiday season. We couldn't get his real name, but the West Fort Santa has been putting smiles on the faces of children and grown-ups for the past 18 years. And if you miss him today, don't worry, he promises to be back on his bike next year, starting December 1st.
I started with just a beard mask and a hat, and then there's gentlemen at a Robbins, and they go, "You need a reindeer." So then I put a reindeer out in the front of the bike, and then I ended up putting a wagon, and I bought a suit, and it's just grown to what it is now. I like doing it. It's good exercise, and people love it at the same time. So it's just fun all around.
Well, Fiona, it was a cold one out there today for Santa to be